Welcome to another episode of The Real Diagnosis. We appreciate everybody tuning back in for another episode. This week, we want to focus on a subject that I believe is a concern for many minority communities and definitely for the Muslim community. Something that is not easily talked about. It's a tough discussion. And so we want to talk about mental health in minority communities. And we have a special guest today, Dr. Ali Anwar, who is an American board certified psychiatrist. He is somebody who I know personally. We went to undergrad together. And so I want to thank him for coming on the show and talking to us about this subject. Ali, thank you so much for coming on.
Thank you, Dr. Ahmed.
So this is something that I think the Muslim community in general, they struggle with bringing up this conversation. They struggle really kind of focusing on it, and it's such a crucial aspect to somebody's overall wellness. How would you recommend people bringing up this discussion? How do you, broach the conversation of mental health?
Yeah, no, I think that's a great point. I think it's a difficult topic to bring up in our communities because it's not something that we often talk about. I think a lot of Muslim Americans, a good portion of us are first generation or second generation, and it's not something that's really talked about in immigrant communities. I think in general, most people aren't emotionally literate or well-rounded enough, and I think that's more so prevalent in immigrants, even more so than people who here. But I think the thing is that as we kind of assimilate a little bit more, and we have with our generation, I think it's getting a little bit more. I think the most important thing is first thing is it's okay to talk about negative emotions. It's okay to identify that someone may be having negative emotions, and I think awareness of that is really the first step.
Yeah, I mean, that's probably, as you mentioned, the first step. It's probably the hardest step. And so, what are some of the ways that we can, as people from a second generation or even third generation, when you are kind of trying to reflect on that and you're trying to kind of take that first step, raise that awareness, how do you recommend that somebody brings this up to maybe immigrant parents, if you have immigrant parents, or how would you kind of start that conversation? What would you recommend?
Yeah, no, I think it's a great point, right? And I think it's one of those things. It's a hard conversation to have, outside of that emotional context, right? So, but at the same time, when emotions are heated or high, then you can't really have it in that moment. But I think it's to kind of just bring it up in a calm, collected manner where it's a comfortable and safe position for, let's say, that parent, whether it's the home or someplace else. Even though you got to expect that there may be some kind of pushback on it, in the sense that they may be like, why are you talking about this? Why are you bringing this up? And that's not necessarily a bad thing. I mean, it's an expected response because that's not something anybody's used to. It's not something, they may just not be that emotionally well-rounded.
So this actually brings to mind something that's pretty interesting. So there is this notion of like this generational, trauma that can kind of exist, and particularly for minority communities because of various acts of oppression or discrimination that they've been through. And I think of kind of the Muslim world and these Muslim communities, and you think about how many people are escaping various tragedies or occupations, war, famine, hunger. What is that something that people need to come to terms with? Is that something that people need to recognize? Is that a real thing? Because we hear about it a lot.
Yeah, no, I think it's definitely a real thing. I think that's prevalent in the Muslim population, especially when you look at the Muslim world. I can give you an example of a different minority population. For example, I practice here in Minnesota, and this has been my first experience with Native Americans. And there's a lot of generational trauma with this population that exists. And I think that different types of trauma you can see across other minority populations, especially people who've come here, and there's varying levels of generational trauma. But I think you brought up an excellent point, right? And I think that it's not the same trauma that every Muslim person faces, right? Depending on the circumstances that brought your family here, what part of the world you're from, it's going to differ. And just based on the part of the world your family comes from or my family comes from, there's generational trauma, I think, on both sides, but it's going to be different, right? Based on the circumstances.
Wow, yeah, that's something that I think is something that we're starting to first hear about this term. I think it's starting to come into the consciousness, and so it's. I hope it's something that can kind of generate that discussion and that dialogue. So you mentioned that you kind of are in Minnesota now. You're practicing. There's plenty of minority populations out there, refugee populations as well. You notice a similar trend among various, minority communities kind of being considered other, like an other racial group type of thing? Are you noticing kind of similar struggles?
Yeah, I think it's if I'm understanding your question correctly, I think so. Yeah, I think this is where I practice is a very interesting geography, let's say that. Like, I mean, you have a lot of different races. You have a big refugee population. So we have a lot of Native Americans here. We have a lot of Somali refugees. We also have a big Hmong population here. So I think there is that fear of being characterized as other, especially with the current circumstances, politically and whatnot. People do run into that.
Right. And how do you build that trust? You're obviously a psychiatrist, you're board certified, people are coming to you looking for help, but I'm sure that there needs to kind of be that doctor-patient relationship that's kind of built on trust. Yeah. How do you go about that? How do you kind of open up those lines of communication?
Yeah. No, I think that's a great point, because I think it's really important for any individual to really trust their doctor, right? But especially their psychiatrist, because these are some very personal and very sensitive issues that you're dealing with. And if they don't trust you, then, it's not really going to be effective. And I think the most important thing personally I like to use is it's a collaborative decision that we make together in how we approach it. And, I primarily see children and adolescents. So this is something that, I try to avoid, at times I will, but as much as I can, the paternalistic nature of our profession at times. And so when I'm dealing with adolescents, it's a team decision, myself, the adolescent, the parents, or guardian, or anybody else that's involved in their treatment.
How are you able to communicate with parents? And I guess the second part of that question is, what is it that you're recommending to parents nowadays in the climate and the atmosphere that kind of exists in this country specifically? What are you telling parents to do? How are you telling them to contribute to the overall health of their children?
Yeah, I think so. The first thing parents can do is actually take care of their own health before they take care of their children's mental health. Because what we do know, especially when you're looking at little kids, and I see pretty young kids as well, the most important thing that you can do is actually make sure that the parent themselves is mentally stable. And I think oftentimes treating the child or adolescent means allowing the parent to recognize that they need help, to make sure that they're mentally stable and with it. And, in these times, part of it is it's difficult, right? Because this is unprecedented with the pandemic and everything that's going on. We've never really experienced this. So part of it is also recognizing when you need help, and recognizing when, hey, this is a normal reaction to some of the really scary stuff that's going on in the world.
So there are going to be people who are initiated, I would say, or who are comfortable with the idea of discussing mental health, who are comfortable recognizing their own issues and trying to deal with that. And as a result of that, I think you may run into others who you may think are struggling, and you want to help them, loved ones, friends, coworkers, and I always wonder myself, I think as an ER doctor, I'm always getting these snapshot pictures of people, right? They're showing up, I interact with them 5, 10, 15 minutes of like actual human to human interaction. And you can recognize these various signs. Like, I think this person is looking for some help and they just don't know where to go or what to do. What would you recommend to people who are kind of recognizing these signs in other people, and they want to help them, and they know that those people are looking for help as well?
Yeah, no, I think it's great. I think, it's really important that, you seek out the help when you need it. But here, the biggest thing I tell people is, it's hard right now in our country to seek out help, whether you have resources or not. And oftentimes your first experience may not be a positive one, right? But unfortunately, what I see is with mental health, oh, I went and saw a therapist. I didn't like them, so I just didn't try therapy again. Or that medicine didn't work for me, so I'm not going to take any medicine. So what I would say is, it's really important that you give it multiple shots, and not just one and done, and I think it's really, especially with mental health, because it may take time for you to develop rapport with your therapist or your doctor or somebody. And, and I recognize that it's really difficult. And it takes a lot of persistence on an individual who's struggling to really seek out the help, because we just don't have enough people in my field.
Yeah, definitely. That's true. Definitely. Let's take a quick commercial break. When we come back, let's talk to Dr. Anwar about what's going on currently with the COVID pandemic and some of the ways that we can kind of tackle the challenges that are associated with that. We'll be right back. All right, and we are back. Salam, everyone. We are back with Dr. Anwar. We're talking about mental health in minority communities and in Muslim communities. The COVID pandemic has hit everyone everywhere. So there's not a single country that has not been affected by this directly or indirectly. Specifically in the United States, it's become this beast of its own. It's affected our healthcare institutions, but it's also become this political weapon. And as a result of that, there have been a lot of people who have unfortunately and tragically died in this process. Over 100,000 people have died. There are millions of cases. We're dealing with a lockdown. This is totally unprecedented. And so with that, there have been some serious issues. It could come from just kind of being in lockdown, losing that social interaction. But then there's also the really tragic cases where a loved one is showing up to a hospital, they're alone, they go to the ICU, and they end up dying. And that's something that's really hard for people to deal with. In your opinion, what are some of the ways that we should be coping with this, or how are some of the things that we can kind of synthesize what's happened and really try to process it in a way that can be healthier than maybe internalizing it and keeping it on the inside?
Yeah, that's a great point. I mean, I think the first thing I tell anybody is, the term we use is social distancing, but I really wish the term was physical distancing, because I think it's actually more important now than ever to have social interactions. And what I mean by that, I don't necessarily mean in person, go to big gatherings. No, I don't mean that. But for example, you'll find that family is a big thing amongst minority and immigrant communities. And for anybody who's used to seeing family, that's their main primary support. All of a sudden, you're distancing and you don't have much contact. So it's really important to find ways, whether it's through Zoom, social media, phone calls, keep it up on a regular basis as best as you can, given the circumstances, in order for your own mental health, because it's a healthy coping mechanism.
Right.
I think that the circumstances that you brought up it's almost like a nightmare scenario, right? A loved one is really sick, they're dying in the hospital, and you can't even be there with them. And there's not anything you can really do about it. And if it was a situation where you could be with somebody, you would be there, you would try to be around your support, right? Your family or your friends. So it's really important to kind of physically distance, but not socially distance, and keep in touch with your family and friends more now than ever before. And I think that's the number one thing I try to recommend to people is, like, there's a new normal and we have to kind of start working towards that.
Yeah, I think that's a really great point. One thing that seems to occur whenever there's a COVID-related death, or even when somebody's dying during this time from something other than COVID, it seems like the grieving process has been interrupted, and people are not able to do the things that they would normally be able to do. And that's kind of what you mentioned: surrounding themselves with loved ones and staying in that kind of in that area where they're comfortable with that support that's there. And so that's been a major issue. Now that's kind of the more tragic side of things. What do you think about, kind of living in lockdown, there are a lot of additional stresses that are coming on, such as financial stresses, even people with children having to worry about childcare issues.
Mm-hmm.
How do you keep the sanity in all of this, this chaos?
Yeah, no, I think it's a great point. One thing I also tell people is it's really important to stay up to date, but also take a break from all the stressors in the world, right? Like, obviously, job stressors or stressors trying to find, with childcare and whatnot, it's going to be different. But I think the normal recreational outlets aren't there, right? So, for example, maybe for one family, it was you normally go out to eat dinner, right? But all the restaurants are closed. You can't do indoor dining. So, it's always good to kind of try to find new things that you can do within the home or in a safe manner, that are friendly. So instead of going out to eat, maybe you do something different at home for dinner or something like that. Something that you can do. But I mean, it's really important to kind of keep up some of the recreational coping that you would have, as best as you can, because the stressors of finding childcare, the stressors of job, some of those things are out of your control, right? One example is that, if a family member, you resort to a family member who takes care of your child, for example, a grandparent, right? But then you're also worried about exposing that grandparent to, so there's a lot of stressors that are just kind of, you can't really control. So it's important to take advantage of what you can control. And that's to kind of set aside a specific time, whether it's once a week, once a day, to kind of de-stress and debrief a little bit.
So by that note, I take it that you're not somebody who would recommend somebody being glued to the 24-hour news network about all of the latest things. Yeah.
No. I mean, I'll be honest. I don't either. I mean, I think for me, with the basketball being back was a nice little kind of normalcy, So I would definitely not recommend that.
Absolutely. I mean, on the flip side of all of this, there also seems to have been this emergence of some really kind of diabolical conspiracy, theories like floating around, and a lot of people attaching themselves to it, whether it's people believe coronavirus is overblown, or a more extreme version, something totally off in the woodwork. Why do you think people during these times of uncertainty maybe try to gravitate towards something dismissive, maybe like is it because of that fear, they want to believe it's not as bad as things seem, or what is it about it that kind of gets people going?
I think it's a great point. I think our people in general gravitate a lot towards conspiracy theories or things that lack a lot of evidence, right? I think you're going to have that set of population who are always gravitating towards conspiracy theories, right? No matter what the situation. But yeah, I do think that for some people, it's almost like a sense of relief. You know what? Maybe it's not as bad as it is. But it's really hard to say. I mean, because I don't think I've ever lived in a scenario where the conspiracy theories were being pushed to this level and by very powerful people. Really, usually it's something kind of in the background, right? So it's really difficult. I think it's kind of a mix of things. I think it's that comfort that they're trying to find some hope. There's the usual people who are always kind of paranoid and believe in conspiracy theories. And then it's being pushed by one side of the political spectrum.
Sure. Yeah, I think that's the biggest issue, right? Is you have some extremely powerful people who have a lot of influence who are saying one thing, and then you have maybe the CDC or you have these other healthcare experts saying another thing, and so suddenly you have two views out there when you really wish in a time like this where there's this global pandemic that there was kind of a one voice out there trying to help people fight this the best that they can.
Yeah, and to your point there, like the thing is even our institutions like the CDC and whatnot, usually when we're following their advice, it's based on lots of research, lots of science. And I think what people know is that, this is kind of, they're learning this on the go. And that doesn't help because people know that. So they try to find whatever they can. And, you're just kind of hoping for the best.
Yeah, definitely true. I mean, I can say from my own firsthand experience in the emergency department here in Chicago, it's, in March, we were figuring things out on the fly. We were trying to figure out what they were doing in New York, what was working. And so I think part of that has fueled all of this. There is an uncertainty that exists. We haven't dealt with this before. So what are we going to do and how are we going to tackle it? And it's unfortunate that there are so many voices that are muddying the water. Let's take a quick break and we can come back and I would like to get some final thoughts from you, Dr. Anwar, if you can stick around with us for a few more minutes. And we'll go from there. So everybody stay tuned. We'll be back. Okay, and we are back. This is The Real Diagnosis. This is the episode about mental health. We have a psychiatrist with us, a good friend of mine, Dr. Ali Anwar. So we were just kind of talking about how to cope with some of the madness that's come along with this COVID pandemic, with a lot of the civil unrest. And I wanted to touch on a couple of, I wanted to talk about the civil unrest. I wanted to talk a little bit about what's happened in this country specifically and regarding the topic of race and some of the things that we've noticed. As a member of a minority community, the Muslim community in this country, we have had to deal with various forms of Islamophobia, whether that's been institutional or it's come as government persecution or even just kind of on college campuses or in the workplace. And so, there is, we understand some of the racial tensions that exist. How, in your opinion, how do we move forward in terms of discussing some of these issues? Because it just seems so polarizing and there's so much emotion behind it. How can we bridge that gap? What are some of the things that we can do to address these issues without all of the violence or without all of the polarizing opinions?
No, I think that's a great point, and it's a very difficult thing to do actually because of the way our climate is right now. I think as Muslim Americans, one thing we need to do, and this is something that I'm relieved that it's coming up more, is try to first recognize our own prejudices because nobody's perfect. I think nothing is every, it's not all or nothing. It's not, you can't really go into this concrete all or nothing type of thinking. Everybody has engaged in some sort of prejudice or bias. And I think you need to kind of come to terms with that and how you can work on that. And I think seeing it in yourself will, kind of help, in recognizing it in yourself will allow others to hopefully recognize it within themselves and start that conversation. I know personally I live in Minneapolis, not too far from what happened with George Floyd. And this whole situation, has really opened my eyes and really caused me to self-reflect, as well as members of my family, as to kind of identify some of our own prejudice or bias we may have. And I think that's really important.
Yeah, I mean that's such an excellent point, and I think people are reluctant to kind of admit the own bias or prejudice that they may have, and I think that's got to be the first step into just kind of moving forward. I wonder, I always wonder. I can't imagine the life of a Black American in this country. I can't imagine how that also affects their overall kind of approach, and how somebody cannot just kind of become cynical about the prospects in this country when it seems like there are so many forces working against you. It just how can, I guess, personal, like on a personal note, if I feel like there are so many things standing in my way and there are so many obstacles, how can I keep that wellness? How can I keep that balance? What are the things that I can do to kind of move forward in a positive manner?
Yeah, no, that's great. I mean, I think what you brought up a great point, because one thing we know for sure is it's really hard being Black in America. I think when I look at my own field or my own experiences with patients I see, an adolescent white male is much more likely to seek mental health services than an African American male or a Black male. It's just what it is. It's more likely that the Black American is going to get first encounter in the juvenile detention or legal system, right? And it's really unfair. I think it's tough, but I think part of it is the kind of stepping back to using whatever your goals or whatever your drives are, right? And using your support as best as you can, because one thing that is good is that the sense of community, the sense of family is strong in minority communities, including Black communities. And one thing I've learned is that, so for my example, minorities, but even Black Americans have a distrust of the medical system and the mental health system, right? But if there's an untreated mental illness, that's much more likely that they're not going to succeed in whatever goals they have to accomplish. So it's important to take advantage of that community and trusted individuals that they have around them to kind of get them the help they need. So I think it is relying on the support that you have as best as you can, trusted support, whether it's family, members of the community, or friends.
So that's and I guess let me ask you from this angle. How
Yeah.
can us as providers, as people who work in the healthcare profession, people who kind of have these services that we know have not been accessible to various minority communities, what can we do to be better? What can we do to change that?
Yeah, I think that's a great point. I think within each medical specialty, we kind of need to recognize, well, what are ways that are maybe different, right? Unfairly treated, right? So in my specialty, it's an adolescent Black male is going to come off. They're going to assume that he's more aggressive than an adolescent white male, and maybe be put on an intensive care psychiatric unit just within the hospital, right? Or the diagnosis of schizophrenia in adult males, African American males, is much more likely to be given than a bipolar diagnosis, right? And when you give somebody that diagnosis, it's a pretty different prognosis than bipolar disorder, right? So kind of recognizing within your own specialties, right? So you're an emergency room doctor, to kind of looking at, well, one thing that we know is that Black females are much less likely to get pain control compared to white females, right? So like recognizing within your own specialty, I think, and maybe personally, because I think the difficult part is you don't even realize that maybe just because you just continue standard of care and you're kind of in the system, how much you might actually be contributing to that system that needs to be changed.
Yeah, and I think you bring up a good point, because I think we can all think of instances in our practice setting where we've noticed maybe some microaggressions that have taken place
Yep.
against minority patients, and
Mhm.
how would how can I go about tackling that in a healthy fashion, and that goes across all spectrums. It can be in a clinical environment, it can be in a school environment, it can be in a community setting. How do we go about that in a non-confrontational way, where we say, hey, we really think that this is an issue here and we want to get better together?
Yeah, no, I think starting that conversation is good, and I don't think there's one right answer. Unfortunately, I think the situation, it really depends, and I think the first step, whatever I say in anything, right, um, recognizing it and educating yourself. So, for example, when I'm diagnosing and I'm treating somebody with mental illness, one of the first things we do is called psychoeducation, educating the family, educating the patient, educating the child, everything, right? So, kind of educating yourself and trying to recognize your own, I think, is the first step before you even start a conversation. Because how to actually start a conversation, I don't think there's one single way to do it. I think it's really different, and it really depends on the circumstance.
Yeah, that's definitely true. I mean, I think most people realize how hard it is to begin a conversation and to kind of tackle it and to also express, even if you feel like you are an ally to a minority community that's being persecuted or oppressed, you want to be able to express that in a way. And I think people struggle just kind of figuring out how to do that.
Yeah, no, I think, and you bring up a good point, because being an ally doesn't necessarily mean that, it's always, sometimes you just got to listen, because, I think that's where it comes back to educating yourself. You got to just hear the other person out. And I think that's where and even then, that's just a start. I think that we're all kind of learning on how to appropriately go about this.
So I'll ask you this one last question. And since you brought up listening, you're somebody who to be successful in your field, you have to recognize and be able to listen and really hear. Any tips about how we can do that better? When somebody's trying to speak to us or they're trying to communicate something that's important to them, how can we be better listeners?
Yeah, no, that's great. I think first of all, like giving them the time of day, right, will also mean that they need to feel, because you know what, we're doctors, we're busy, we're always on the move, and even this is something I have to practice and ground myself on as well, is body language, right, is a big thing, right? So eye contact, looking forward, not looking away, and kind of really engaging that way, right? Because there's a lot of nonverbal cues that you can give to somebody. Because I think we're used to multitasking. We can be listening and doing something else, right? But also, that person's not really going to open up to you or really have an honest conversation unless they feel you care and are listening. And I think body language is the biggest thing. It kind of takes you back to the simple, like, patient interview classes we had in medical school.
Yeah, that's so true. Yeah, I think one thing that I learned more recently is just about how even kind of sitting down versus standing up makes a
Yep.
difference for someone, right? Like looking at your watch, people recognize these things, and you may be subconsciously doing it, but I think it's important for someone to know that if you care, that you are there for them. Just kind of being there.
Yeah, yeah, no, you're right. I think certain, like, body movements, or just kind of just being there, not assuming you're rushed, makes a huge difference.
Well, I want to thank you so much for coming on this show. This was an awesome conversation. You have an incredibly tough job, and you were able to kind of help us understand some of the challenges that we all can recognize and hopefully work towards. And I hope you would visit us again, and we can kind of have another conversation, inshallah.